Morning, everybody. I'd like to call to order the Public Health Committee for August 16th, 2023. And I'd like you to know that today is National Roller Coaster Day. In case you needed to know.
Thank you, Ken Shepherd.
And National Tell a Joke Day, as well as National Rum Day. So I'm thinking the more rum you drink, the more jokes you tell, right? So clerk, please call the roll.
Juby,
Over here.
Silva,
Here.
Tarver,
Tarver's here.
Williams,
Williams here.
Young,
Young here.
Sanchez,
Sanchez present remotely.
Strathman,
Strathman here.
Tepe.
Debbie here.
You have a quorum in the room.
And we have some remote attendance requests from Mr. Tarver and Mr. Sanchez. Is everybody okay with them being remote?
I sent a request in as well. Chair,
Oh, okay. I did not receive that, but who did you send it to, Rick, just so we know?
I sent it to the COB attendance email
Okay.
and I copied you, Cheryl.
Okay, thank
It
you.
was this morning.
Okay, so we'll add Mr. Williams to that as well. So, okay, I would like a motion and a second to approve the minutes from July 19th, 2023.
So moved.
Tarver seconds.
Okay, we have a second. Please call the roll.
Juby,
Aye.
Silva,
Yes.
Tarver. Mr. Tarver. Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
approved.
Okay, and we have some speakers this morning. And at this time of our meeting, this is for speakers who are speaking on agenda. The people who have signed up, is this on agenda? Not on agenda? Okay, we'll move that to the end for Dr. Bresnahan. And Ms. Shulka, are you speaking on agenda?
No.
Our new policy is that we'll do it at the end. I don't expect to have very long meetings, so we'll see if we can get you. Okay. And the monthly reports are attached and on file. Anybody have any questions? Okay. And Mr. Youngstead, you're up.
Possible. Good morning, everyone. All my reports are currently on file. If you have any questions, of course, please let me know. I'm always available. Something I wanted to discuss here that we've been talking about recently with Madam Chair was the bringing a generator to animal control. Animal control has been in need of a generator. It was actually in the initial plans. I've met with building management already to also discuss this because we're one of the buildings on their list that they're also wondering why it doesn't have a generator. We have animals at our facility 24/7. We have employees at our facility 365 days of a year. Solar panels are great, but solar panels don't work at night. Solar panels don't really work in winter. They produce minimal compared to what our volume would be needed to run our heating units. So sorry, let me rephrase that. So it's something we've been discussing that if there is ever a power outage. I was one of the employees that was present during the boiler blowout at City of Chicago when it went, and it really was a nightmare for the staff, and the public had a field day with it. And it's something I don't want to go through again. I'd rather be preemptive and proactive than reactive when something happens. So building management has reached out. They've given me 2 companies to try to get some bids from, and that's what I've currently done. I've reached out to them. I haven't gotten the information back. I've reached out to Mr. Sanchez and seen if the possibility for ARP funding is there. It's just something me and Chairman Strathman have talked about that we wanted to bring to the committee and let you know what we've been looking at, why we're looking at it, and why we think it's important for the county. If anyone has questions, I'm always available. Please let me know. Thank you.
Any questions? Yes, Mr. Young?
Do you have a cost associated with this? Did you pick out a generator? Would this just be for a full entire to have power for the whole entire facility, or just, a small generator for, the air conditioning unit or whatever.
So I'm glad you asked that because that's where I'm at this point. I don't have numbers for that reason. Because honestly, at the end of the day, that massive unit, if anybody's been to our facility, in the back of our facility, is really, that unit itself is $500,000. It's a massive unit. It powers all of our heating and air conditioning for all the animals. The front units have 3 more like household style units that even if I could get power to those units and electricity to the building, we could open all the doors and actually get circulation going through the building to heat and cool. So that's something I'm going to discuss with the companies that come out. Our second thing we're looking at is whether we go natural gas versus gasoline. The reason for that being is in an emergency hitting this county, we lose all power because we always have to look to the worst disaster when we disaster prepare. Gasoline first has to go to the jail. We know that. Second has to go to KCOM, OEM, Building B for those sorts of things to get up and running. Totally understandable. So when we look at chain of gasoline, where do I fall in that line? So that's why I'm trying to also look at another method to maybe use natural gas, something that doesn't get hit as often in an emergency. It's more electricity than natural gas. If there's a way we could somehow power it through that means to not have to take a burden of the county in an emergency trying to figure out more gasoline usage. So there's other things I'm also trying to factor into that decision, if that makes sense.
Yes, Dr. Silva.
Good morning. Some of my questions have been answered. Thank you for that. As you know, I'm a big animal lover, and I think that a lot of times in disasters, animals are forgotten as much as we do have organized folks who will come out and help. My question is when, perhaps even if Mr. Sanchez could chime in, does it sound like we might have ARPA funds for something like this?
I don't know. And I'm just being honest because I
wonder-
just
you were
reached out
wondering.
and it was something we were discussing recently and said, hey, would funding be available through the source? We reached out and asked, I don't know at this time. I just know I'm trying to reach out and find out any opportunities available is what I'm trying to look into.
And if you don't mind, I'd love to stop by and kind of
Always.
see what you're talking about.
Sure, and you can play with the kittens.
Okay, thank you. Thank you so
Of
much.
course.
Mr. Sanchez,
Thank
do
you,
you,
Drew.
do you have anything you could add for us at this moment?
Yeah, Chair Strathman, we would have to do an assessment on the possibility. Just based on my knowledge, it would be probably pretty hard to fit it into the ARPA eligibility criteria. So we'll be happy to take a look at it. And Brett, I texted you to give me a call after the meeting. Your email got lost in the shuffle when I was out of town. I apologize, but we can definitely take a look at it and see if it is eligible for ARPA funding. But if not, I think we could probably work with finance to find a potential source of funding for it otherwise.
Okay, great. Thank you.
Thank you.
Any other questions? Yes, Ms. Juby.
Well, first of all, I'm surprised we don't have a generator there. So I'm shocked. What is the potential timeline on this? So when do you expect to get your bids back? I mean, are we looking at like 8 months? We're looking at 6 months from start to finish to get you this generator?
Funding is really going to be the issue. Funding is going to be the issue. So it's a matter of timing, going to be based on funds. We're also at a really weird period right now where our company we have on contract is done with us September 1st. The new contract starts September 1st with the new company. So I've reached out to both companies, and the one who's no longer going to be the one who won the bid has not responded at all to me, which I'm not shocked. They're going their way out. The new company just hasn't set a date yet because they're kind of waiting for the start of the new contract to kick in. So I'm at a weird position of when I've tried to obtain this data. So I don't have much this month, and I apologize. Hopefully I'll have more next month because I usually like to come with all my numbers, and I apologize I don't have it right now. And then once I have the numbers, it'll be a matter of where's the funding, when is funding available, and how soon could we then get it done with the company?
Okay.
Hopefully not long, but I don't have that specifics and I apologize.
Okay, I don't know how it works with government entities, but I know that there's all kinds of grants available for animal welfare. I don't know if that's something that we would be able to apply for because we're a government, but it might be some interesting conversations.
No, definitely. And I am always paying attention to every grant available to government from animal control. They are limited. They more grant to the 501c3s, which is
Yeah.
where a best friends organization would be a huge benefit to us.
Right.
And we've tried to investigate that. There's a lot of other sticking things on that. But as for the grant funding at this time, there's none available. A lot of the funding available for the government side is after emergency response. So after you've completed the hoarding case, after you've gone in and dealt with the personal emergency, well, then we'll refund your money back to you. Well, I like to be more proactive than reactive, which is why I'm usually stuck in this side.
Okay.
It took us close to 8 years to put together our county animal response trailer, which if anybody was at South Elgin recently, we had it out there for National Night Out. It took me, 8 years to get that up and running. And at least we are prepared now in an emergency to be able to house animals quickly and get to wherever the Red Cross wants us to be, sort of thing. So we're much further along than we've ever been. It's now preparing home base, sort of thing, is what I'm looking at, is how do I ensure that our home facility is now taken care of now that I've taken care of the offsite stuff.
Okay.
So it was more of, I had a lot of checklist stuff to go through when they started 9 years ago. So I've been slowly working those down, and this is the moment I'm at right now. And that's why I just wanted to bring it up. It was in the initial plans, but I can't speak for what happened 18 years ago, why it wasn't put in. And it's funny because we were in an OEM meeting 2 years ago, and here's a list of all the buildings that have generators, and animal control was on there, and I had to correct them that it wasn't, and everybody, even in OEM, was shocked. So it is something I want to make sure that we looked into further and we continue to investigate. And that's just where I'm at the moment, is finally getting to it on my checklist.
Okay.
And that's why I'm addressing it and wanted to make sure I spoke to everybody about it.
Okay, great. Thank you.
I would like to say, according to the report, you had a very busy month of July,
Yes.
very busy.
It's getting to that peak summer where things are really peaking, and from now till December is peak of everything for us. And then December will start to slow down. January, February is our slow month. And then comes March, April, back into kitten puppy season, and we'll kick off again back into the year.
Okay, okay. And I would like to move on with a motion. We have could I have a motion and a second for the resolution for animal control? Do I have a motion and a second?
Silva moves.
Second?
I'll
Tarver
second.
seconds.
Okay, Mr. Young seconds. Brett, would you like to read the resolution?
I
for us,
sure
please?
will. Blair, do you have a second to pull it up? Sorry. This is our resolution for our animal rabies tags. I wasn't happy to have to bring this forward. When I made the resolution to change tag fees 2 years ago, we didn't know about the IT fees at the time. And those are about $50,000 a year to my department. So unfortunately, with the inflation, cost of everything going up, we're doing that payroll study right now to fix wages in our county to at least be competitive. Everything's kind of increased, and I've had to bring tag fees along with it. So that's what this resolution was brought forward to. And it's that King County Animal Control seeks to update all rabies tag registration fees. Whereas the fees collected from these rabies vaccination tags fund animal control and all the programs they run. Just so everybody knows, about 98% of our budget is run through these rabies tags. This is where our main fees, our main money comes from. The altered tag fees will change by $3 for the 1 year. And $9 for the 3 year. The unaltered tags will change by $5 for the 1 year and by $22.50 for the 3 year. The King County Board does hereby authorize King County Animal Control to raise registration fees starting January 1st, 2024. The cost of the registration fees for spay neutered altered dogs and cats will be $15 for the 1 year and $35 for the 3 year. Unaltered will be $40 for the 1 year and $90 for the 3 year. These fees actually put us right in the middle of all the other collar counties because we take out Cook County and we do our study. The reason for the differential change is this is at about a 2.65% change between the 1 year and 3 year, which is about average to what most counties do, because what you do is you want to give that little bit of an influence to go to that 3 year vaccine because it is healthier for the animal. We understand that. So it's not about making the money. It's about encouraging people to go to that 3 year. Which we do highly encourage. So this puts us right in the middle of pack of where everybody is at the moment. We actually went from the lowest tags around the counties to this will put us more in the middle. And that's where I'm trying to stay, because I'm trying to do everything I can to continue to fund this facility and still ensure those senior tags are free, because we, again, are the only county in Illinois that does those free senior tags. I'm doing everything I can to try to keep that. And that's why this is where the numbers fit for us to be able to do that, hopefully for the next couple of years.
Okay, do we have any questions? Yes, Mr. Tepe?
Yeah, Brent, I'm assuming that most of these fees are collected, by vets and other municipalities, right?
Correct. For the most part, yes.
Do you anticipate any problems in changing this and communicating with them or anything?
No, 2 years ago, when we changed the tags, or 3 years ago, we'll be at the point of this one, we learned how to do it. We got letters out ahead of time. We posted through Kane County Connects. We did press releases. So we got it on internet. We really got it out throughout the county that we were able to handle it last time. And we learned some of our glitches to be able to do it better this time.
Thanks.
Any other questions? Okay, clerk, please call the roll.
Juby,
Juby, I.
Silva,
Please come back to me.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
Silva,
Yes. Passes.
Okay, thank you.
reluctant, but yes.
Okay. And moving on. It's to Michael Isaacson, Executive Director.
Good morning, everyone. Good to see you all. Just a few quick updates this morning and a couple of resolutions. I want to start with some staffing updates. So I'm really excited. I've been in this position just about a year now, and we've made some changes in how we're organized. We've created a new division that we're calling the Division of Planning and Information Management. So one thing when I was interviewing for this position that I talked about is I'd like to be able to get information to people, data to people. So whether that's board members, mayors, community organizations, et cetera. So we have a director who's hit the ground running in this group. We've added an additional epidemiologist to our team. So really excited to be moving forward with that. Also, we have promoted someone, Kim Peterson, who Kim and also our other new director, Liz, is actually at new employee orientation this morning right now. But we have Kim Peterson, who's been promoted into our Director of Community Health position. And this is where our behavioral health programs are. So we're really excited about the future. And we've talked about this extensively. What is going to be the role of the Kane County Health Department? I presented just one slide on this last month, just talking about some principles that we're keeping in mind. So there'll be more coming on that. We've hired some additional people and promoted some internal people. That's something that's important to me, is as much as possible to create additional opportunities for people who have been successful in their roles and have proven that they're ready for more responsibility. So many of these positions have actually been internal promotions. We have a new internal promotion helping us with outreach and social media. So you'll see some of my slides here look much nicer than the things I typically put together, because now we have somebody who's good at it that's doing it and coordinating all of our outreach activities. So when we're out in the community, I think we have a much more unified voice with what we're doing. We've promoted somebody to our new quality improvement activities that we have going on. And then you'll be hearing a little bit more. But over the next year, it's time for us to go for reaccreditation, for national accreditation. So all of that is going to be due in December of 2024. So there'll be more about that over the coming year. New substance use prevention coordinator, internal promotion for our tobacco program for somebody who's coordinating that work now, and our new violence prevention coordinator, which is a brand new role. Just hosted their first meeting with our group. And again, this is focused in Aurora for this particular grant, but just had a great meeting about a week ago. So really exciting, the growth that's happening in terms of being able to address services that we've identified as being gaps in the community. Another item I'd just like to bring to the committee's attention. We have a newly formed ad hoc opioid settlement fund committee. So I will be chairing this committee. Members included Sheriff Hain, State's Attorney Mosser, Coroner Russell, and Public Health Committee Chair Strathman. We just met for the first time about 2 weeks ago. We'll be keeping you all informed about what we have going on. This is very mission aligned with the work that we're doing, especially as we look at what the role of the health department is in the future around substance use. So right now we're assessing the funds. So let me back up a second. This is from Kane County participating in lawsuits about against people who are involved in really exacerbating the opioid crisis in this country. So municipalities participated, counties participated, the state participated. So right now, Kane County has right around $1 million that we've received from this settlement. And there's going to be funding available to us over coming years. And there's actually still additional details about lawsuits that are still being clarified. So we're looking at what are the things that we can and can't use this money for, working with the legal team to make sure that everything's copacetic with that. And then we're starting to look at what our process is going to be so we can examine what are the internal needs for Kane County, and then what items do we want to potentially have a grant making program where we're giving funding out to the community. So there'll be more about that. I just wanted to introduce it to committee today. Like I said, we just had our first meeting a couple of weeks ago, and then just want to highlight again that the municipalities, several municipalities in Kane County also participated in lawsuits. So they'll have funding, which is great. And then the state is going to be making funding available through what they call their notice of funding opportunities. So Kane County will definitely, as appropriate, either be applying for money directly from the state or will be helping community partners to apply for money from the state.
Mr. Young, question?
Yeah, David Young. The Kane County, as well as other counties, are pursuing lawsuits against who?
So this could be like pharmaceutical companies with the marketing that they did years ago when these drugs first were hitting the market. There's a lot of good documentaries about this, just kind of the history of how we pushed, and it's not just one organization, but kind of as a society in the US, how we push these drugs to market, prescription drugs, to make them widely and cheaply available, over prescribing to people. And we'll hear a lot about people who may have injuries that then once they get off of their pain pills, at the same time, heroin was coming in and was very inexpensive. So that led to, across the country, a huge dependence on either pills that were obtained illegally or on heroin, which was very cheap. Now, of course, we're seeing with so many people who have a substance use disorder because of some of these tactics over the last several years, now that fentanyl has really shown up, the problem is much more deadly because of that. So we have so many people who are using these drugs who may have survived previously. Not good to have a substance use disorder, but now we're losing more people to it. So this is something that Joe McMahon, when he was state's attorney, led the charge for Kane County in that lawsuit, or multiple lawsuits, I should say. So pharmacies, pharmaceutical companies.
Tepe here. Mike,
Thank you. Yes.
Mr. Tepe,
I'm
question?
sorry, were you finished?
Yes, he is.
Will this committee be reporting through public health?
I don't have all the details on that. So, I mean, certainly we're committed to making sure everybody's informed. There were some differing opinions about reporting. So I think definitely we're sharing information. At this point, I don't know exactly who's voting to approve yes or no on the funding decisions. We're working with finance and the state's attorney's office on that.
Good luck.
Thanks.
Okay.
One nice thing too with this is this funding is going to last well over a decade. So it actually gives us an ability to do some planning for things, because it's a bit more sustainable in terms of it's not just one-time funding. Just wanted to highlight a couple of good things. And here's an example of some better looking graphics that Tina Corral from our team, who's leading our outreach efforts, is putting together. Of course, we talked about National Night Out and the naloxone that we've distributed. So keeping with the opioid theme, naloxone is the life-saving medication that can reverse an opioid overdose. So we're working with community partners to make naloxone as available as possible. We talked about potentially putting a vending machine here at the county building so that people could obtain it. And this is anybody who may be around somebody who could have an overdose. So it's just really an important life-saving mechanism to have. Again, we always like to highlight we're not advocating drug use in any way, but this is a way that we can potentially save someone's life. So it's important if we're going to give people time to get into treatment and hopefully stop using these drugs, we need to keep them alive to be able to do that. So you can see just a couple of examples here at the farmer's market. We're doing in Aurora, we're doing a drive-through at our office in a couple of weeks, partnering with the Elgin Fire Department in October to do a pickup. So we have this, it is, as I've mentioned before, it is available to us for free from the state. They use federal funds to purchase this. So we want to make it as widely available as possible. So if you have anything going on in your district, or if you'd like us to set up any events, we'd be happy to talk to you and support something like that.
I know that next month I'm going to Sherman Hospital in Elgin, and I'm going to go to a community health seminar, and I'm going to learn about it and when to give it and how to give it.
Yes,
And
next
so I'm
week,
looking
right?
forward to that.
Yeah.
Ms. Lewis?
I just wanted to mention the fact that there's a vending machine now that you guys put in outside of Lighthouse Recovery. And I think that's just really cool. And there's also a public message there that says, you know, free field to take this, but it also tells you about how you can get help. Because if you do the Narcan and then you don't get help afterwards, it could be a bad situation. But I just applaud the fact that you guys are looking for any avenue you can to get this to anybody. It's very good. Thank you.
Yeah, thank you. And we're trying to work with libraries, places like here, places like Lighthouse Recovery, working with the hospitals to potentially put these machines in their emergency departments. And again, it's something I know people have different feelings. This is part of our harm reduction strategies. So we've talked before about would be nice if people weren't using these drugs. And I've commented, and I know with Ms. Lewis and other people that have lost people that are close to them. This is something that when I talk to somebody who's lost a son or a daughter or a niece or a nephew, and we say, geez, if naloxone was available, they may still be alive. So even if somebody's going through a tough time in their life, or as I mentioned with fentanyl now, some people who aren't traditionally using opioids, aren't using heroin, aren't using those kind of drugs, but can take one pill. Or we're seeing an upsurge in people using cocaine, unfortunately, but now fentanyl's showing up in cocaine. So people who are overdosing, and if they survive, they're saying, well, I've never done opioids before, but it's in their toxicology. We can see it, and they just didn't realize that it was in their system. So we're just trying to keep people alive and then link them to services. With our children's mental health program, again, this is a multi-year grant we have with the Illinois Healthcare Foundation, Children's Healthcare Foundation, where we are working on a model that we call a system of care. And so this is really looking holistically at what's going on. I just wanted to highlight, last week we had a great session on Thursday. Senator Villa and with the state, Dr. Dana Weiner, really talking about some future focusing. So as we talk about, well, what's next for Kane County in terms of how do we fill in some of the gaps, what should be things that the health department is looking at doing, and what are things that we should be supporting our community organizations in. This was a hugely valuable presentation because Dr. Weiner, who was previously at University of Chicago, was hired by the state to lead some of this work in children's mental health. She really shared what they're looking at and what some of the next steps are going to be. And then here in a couple weeks, which I can't believe it's almost September, but in a couple weeks, we're going to have Kate Amber, who's talking about implications for coercive control. So this is something that may be domestic violence. It could be people who are involved in trafficking. If you take it out, it could be Colts and things like that as well. But really looking at implications and what clinicians can do about it. So Kate McCormick is our children's mental health program manager. She's doing a great job. This is one example of the work that's going on. So just nice to share what we have happening there. We work and have worked for as long as I can remember with an organization in Aurora called Compañeros en Salud, which is Partners in Health. And probably for the last 20 years, I would say we've been partnering with them with this health festival. So this is something that's coming up on the 9th of September, and it's a great program where we provide clinical testing to a lot of residents, information that's really targeted to our Spanish-speaking residents in that community, although not limited to Spanish language, but really focusing on what special needs are in that community. Again, it's just a reminder, in Kane County, we have the highest percentage of Latinos of any county in the state of Illinois. So it's one example of making sure that we're providing information in a way that's culturally appropriate to make sure we're reaching people. So this is a great event. If people have never attended, I encourage you to check it out. But you can see a couple of the presentations, knowing your health numbers. So for people really to get in and understand what cholesterol means and what your blood sugar is, things like that. How to read food labels is an ongoing educational opportunity for people. And then some demonstrations on exercise too. So a lot of community organizations participate in this. Compañeros en Salud is a not-for-profit organization that the health department is part of. And like I mentioned, this group's been in existence for about 20 years. Dr. Lulu Blacksmith, who really founded this group, but the health department's proud to have been an active partner for a long time.
Will the presentations be bilingual?
Yes, yeah.
Oh, very cool.
And then that's it. We got a couple of resolutions, so I tried to keep it pretty quick today.
Any questions before we get to the resolutions? Okay. We do have a resolution authorized. I'd like a motion and a second and possible discussion on authorizing personnel hiring to increase behavioral health, community health, and environmental health services.
Sanchez moves.
Sanchez moves. Do I have a second?
Carver seconds.
Juby's.
You can give it to Bill. Bill can have it. It's okay.
Okay. Would you like to read this for us, Michael?
Yeah, absolutely. So the quick overview is this is to allow us to increase headcount with human resources. The health department always runs a balanced budget. So any positions that we bring on, we're able to, we won't do that unless we're able to pay for it in our budget. In a couple of these cases, we have new grant funding coming in that's going to support them. And in other cases, we're as part of the reorganization that I mentioned in my first slide, we're moving some things around so that we can pay for these things with existing grant funding. So this resolution today is simply to give us the authority to increase our headcount. So whereas the 2021 community health assessment identified mental health and substance use as top health issues, and the health department's accepted grant funding from private and public funders to expand behavioral health services, community health services, and environmental health services. Whereas the approved budget for fiscal year 2023 supports the salary and fringe amounts for these positions. Now, therefore, let it be resolved that Kane County Board authorizes the health department to increase headcount to include 2 additional early childhood mental health consultants. So these are the folks who go out and work with child care centers to help those people develop skills so that they can better serve the families they're working with. 2 environmental health inspectors. So especially as building is increasing and we're starting to see restaurants increase again in the community. I think I've mentioned before, there's new USDA food code that's coming out, and they have ratios for how many inspectors you should have per food establishment. And unfortunately, we're way under that ratio right now. So this would give us 2 additional health inspectors to be able to meet that need. 1 lead inspector. Which, side note, I'm always very confused because we have lead positions and we have lead positions. And so it's always very challenging for me to.
We have a lead
Yeah,
lead position.
we don't have a lead lead position yet. So this is an additional lead inspector. We do have a lot of old, we were just talking, we have a lot of old houses in Kane County. So that means we have a lot of lead paint in Kane County. So there's some changes in the way we're identifying kids who may have lead poisoning. And this is kind of a tag team where we have Director Barrett's team is managing the clinical side of this, and Director Onwuda's team is managing the environmental health side, where we're going out and working with homeowners, working with landlords to make the home safe for these children. But we have a lot of work and have a backlog there. So this will bring on one additional inspector and an assistant director for community health. And this assistant director position is a new position. But in that community health realm, this is really part of what we're looking at in terms of being able to expand mental health and behavioral health services into the future. So happy to answer any questions. Again, these are all things we can afford to pay for.
Yes, Mr. Kenyon.
Oh, you don't have any figures for cost?
No, not in this. This is just to get permission with
Usually
HR.
I'd like to know what it's gonna cost.
Yeah,
To do this. I'm just, we like to know these things.
sure. And I definitely can provide all that information. And this, as we're introducing the new HR policies now and the new budgeting policies, I just wanted to quickly get this in. We have new grants, some of which we may need to bring to the board for approval, some of which fit under our umbrella resolution for grants that we get on an ongoing basis that we're just going to have increases. So we went back and forth on that. So opted to just put this forward just for the authorization for headcount, but I can certainly provide all of the financial information as well.
Okay. And I see Mr. Tarver, you have your hand up.
Yes, thank you, Mayor Tarver here. First, I'd like to say, Dr. Isaacson, thank you so much for all the work that you and the county is doing. It's in this new role for myself. It's just amazing to hear all the things that is doing specifically in public health, mental health, and behavioral health to serve our community. So I'm amazed every month I come to these meetings and hear about the work that the team is doing. So just want to say thank you on that first note. And being unfamiliar with the process, I'm just wondering, I heard you mention earlier about the promotions and the internal advancements of a lot of the staff. Is there a process in place, and how does that work when you're interviewing people? Do you collaborate with human resources at the county level? Is that just how do we maximize to make sure that we're always getting the best qualified person for that position?
Yeah, great question. And thank you for the compliments. And we've got a great team at the health department, and certainly work with a lot of great community partner organizations. There's actually a new recruitment policy that just passed out of the Human Services Committee last week that I think touches on some of what you're asking about, that will potentially change if this resolution passes, how jobs are posted internally to other county departments for internal promotion. The internal promotions that I was referencing are internal already, folks who were working at the health department. So they weren't folks coming over from other departments. So when we do post a job, again, we always, if all things being equal, we want to promote somebody if we can, if they're at least equal to an outside candidate that we may be interviewing. But we are always looking for the best candidate we can find. So sometimes that is getting somebody from the outside. Many times it is getting somebody from the outside. But we will post positions through the HR department and then send them out through our various networks, including college alumni boards and things like that, to reach depending on what type of position it is, but say public health programs, epidemiology programs, et cetera, nursing programs perhaps. And then we do our interview process to identify the best candidates. But there may be some changes in terms of timing for how long we post things internally to, which I think 7 days, if I remember correctly, is what was in the resolution last week.
And just as a follow-up, thank you for that clarification. So during the interviewing process, is there like a team of interviews? Is it multiple stages? Does that work the same way it does at the county level?
It does, yeah. And it depends on what the position is.
Sure.
So who the hiring manager may be for that particular position is involved. And we'll typically have one or more people joining them for the round of interviews, yes.
Wonderful. Thank you so much for the clarification.
Great, thank you.
Mr.
Madam
Young, you
Chair,
had a
Sanchez, a question.
Yes, Mr. Sanchez, Mr. Young was first.
Thank you, David Young. Explain the environmental health inspector again.
So these are the folks who go out and inspect restaurants. And they also may work with our well and septic programs in King County. And I don't know, is Director Onwuda online? Because she can speak to it more directly. Otherwise I can.
Let's see her.
Good morning.
Oh, she is there.
Uh,
Good morning.
Good morning.
Yes, I'm online. This is Uche Omuta, Director of Health Protection at King County Health Department. The two positions are for our inspector, environmental health inspectors. You know, they typically inspect food establishments, but they can also, like Michael said, they're also available for our well and septic program. We typically are way understaffed for our food establishments. And I believe Director Isaacson also mentioned the fact that with the food code, we're going to do an analysis of the resources we have for our food establishments. But currently we're less than half of what we should have, the number of inspectors for our food establishments. As if you go up and down Randall Road, you can see that we have more restaurants that eyes can see, and we have not increased our number of resources for the food inspectors for those establishments.
No, I'll just add this gets to be kind of a compounding issue because we see turnover in these positions. You know, back to the old conversation of we're not really paying competitively. So what ends up happening specifically in this program is we're already, even if we're fully staffed, we're under where we should be, but inevitably we'll lose people either to the private sector or to another county that pays better, which means all of those restaurants in a territory, because we have this broken up by territory. So let's say if Brett and I are inspectors, I have my 300 food establishments that I'm responsible for inspecting at least once, but sometimes multiple times per year. And Brett has his list of restaurants that he's responsible for. If he leaves to go get a higher paying job, I'm more mission driven, but if he wants just more money, if he leaves to go get a higher paying job, we have to figure out how to cover that. So what that means is not only with my 300 establishments say that I'm responsible for, but now we have to cover his 300 restaurants. So we're not paying people enough, and we're piling on additional work because all of these establishments have a schedule for which they must be inspected. And especially this time of year when we have festivals, we have inspectors out making sure that the food is safe at all of our music venues and community events that are occurring. So it's very busy. So we need to increase pay, but we also need to just increase our baseline in terms of number of people.
Yes, Dr. Silva.
Thank you.
Yeah, so regarding the inspections, I remember learning that grocery stores are the biggest culprit because there's numerous points of contact with the lettuce that's been packaged and fruit that's been cut up. So I can imagine that is very, very taxing on your staff. And my second point is that I want to compliment both of you directors for staff, because I have actually a septic well and septic issue in my district that I was there for a down tree and then this surfaced. And you're nodding your head, so you may be familiar. And I was just so impressed with the fact that staff is not only trying to protect the folks around, but they were kind and generous with us when we were trying to work with the homeowner to fix this issue. So I think it really is a case of we just want to keep everybody safe. So my compliments to you and your staff.
Thank you.
Directors.
And thank you very much. We do have a great team. And whether it's a homeowner who may have an issue and their issue may be impacting people around them. So we certainly want to remedy that quickly. But same thing for our food establishments. I think the team does a good job where we really look at all of these businesses are our partners. So we're not coming in trying to drop a regulatory hammer on people. We want to work with them to make sure that they're doing what needs to be done to make it safe. So when we do identify issues, we're really focused on education and changing what's going on. So hopefully everybody has the same positive experience that you're saying.
Okay, thank you. Any other questions? Yes, Ms. Miller? Ms.
So
Thomas.
not a question, a comment. So I'm excited about the fact that you're actually getting some positions back. I know when I first joined the board 6 years ago, Dr. Silva and I would have conversations about, how basically years ago, the staff at the health department got cut in half. It was like anybody who wasn't like vitally essential got put to the wayside, and we've seen all the problems that has caused. And now I'm the chair of the Jobs Committee, which is community development. And if we don't, and we talk about the fabulous Fox, we talk about our housing issues, we talk about, jobs, we talk about, Kane County being the best in everything. And if we don't have a strong health department to support that, especially from the emotional and just the community outreach about healthy foods and all those kind of things, then that does not help our county. So I'm glad that we're trying to get you guys up to the level that you need to be to really enhance and make it also the healthiest community. So thank you.
Yeah, thank you. And you're welcome to come to this committee anytime you like with those kind of comments. That's wonderful. Yeah.
Okay, I think we'll call the roll on this resolution.
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
passes.
And I apologize, Mr. Sanchez, did we roll over your question?
Yeah, sorry, I couldn't get to my mic fast enough. I suppose it's still appropriate to ask, but Mr. Isaacson with the Assistant Director of Community Health, is that replacing, filling your big shoes that you left behind? Or is that working under that role? And then the second question for the data analyst, would that analysis come into reporting that would feed into local community health boards and other health or public health organizations?
Yeah, great questions. Thank you. So we moved my old position. I used to be a director before we laid staff off, and as Ms. Lewis mentioned. So then my role changed to assistant director, but it was always budgeted at a director's salary. So we actually turned my old position into the current director position. And then this will be a new position that we're creating that will be reporting to that director of community health. So new position, looking at some new priorities and ways we can expand services we offer to the public. And then on the data side, definitely this is something, and actually we have a meeting scheduled next week where we're looking at specifically how we can support the townships who are looking at 708 boards and mental health funding, that we can get them the best information we can. So as we move forward with our community health assessment process, we're looking at oversampling, potentially doing some additional focus groups, et cetera, to make sure that they can make the best funding decisions locally too.
Thank you very much.
Okay, so that resolution passes. We now have another resolution. Mr. Isaacson, you're up again.
Sure. So unfortunately, we had an error that was a little, I guess, just beyond what could be considered a Scribner's error, but little over a month ago, you voted to approve our contract with this organization, Metopio. And when we cut and paste our resolution into the county system, we had about 3 words here saying authorizes Kane County Board Chairman to execute a contract. So when the Civil Division was reviewing the contract and comparing it to the resolution that the board had passed, they said, okay, this is great. The board authorizes this contract, but it doesn't authorize anybody to sign the contract. So what they requested is just to make sure we dot our I's and cross our T's, that we put this resolution through, just to really clarify. So this is for us to do our community health assessment. You already passed this resolution. And then we just added the words authorizes Kane County Board Chairman to execute the contract. So again, it's resolution 23-291 is the one that already has been passed by the full board. And this is just kind of fixing it for the file.
Okay, any questions? Okay, clerk, please call the roll.
Do you need a motion?
Oh, I'm sorry. Yes. Do we have a motion and a second for this? I'm just jumping the gun here.
Silva moves.
Dr. Silva
Tarver,
moves.
Tarver seconds.
Tarver seconds. Thank you very much.
Tarver seconds.
Thank you, Mr. Tarver.
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
passes.
Passes. Okay. Now, do we have any old business? I have some. We are, if nobody else does, I have some. We have been talking about allowing dogs in unincorporated restaurants in the county, outdoors, where they have outdoor seating. And we have contacted our council to see what the latest and how we might do that. We're considering that we would have to require a variation for the licensing for the restaurants. And so in order to do that, there would be a small fee for our administrative costs to do that. But we're still waiting to hear back from council if that's something that, unfortunately, it's almost end of summer. But hopefully we'll get it in place so that next summer you want to take your pup with you to have lunch outside, you can do it. But that's where we are with that. So, okay. I'd like a motion and a second to replace the reports on file.
Juby moves.
I'll second.
And Young seconds. Thank you.
Madam Chair, a point of order. In speaking
Yes.
with the Assistant State's Attorney the other day, I was informed votes like this that aren't taking action tied to money and funding, we can do a voice vote instead of a roll call.
Oh, on which part? On the reports?
Yes.
Okay. Okay. then
Mr.
let's-
Sanchez is correct.
Okay, then all in
As
favor?
usual.
Aye.
Yes, we all know that. So those in favor of putting reports on file, please say aye.
Aye.
Aye. Opposed? Okay, great. I don't believe we have need for an executive session. Okay, any new business? Yes, Mr. Young.
Hi, Mr. Young here. This may be brought up in the new public comments coming up, but I just wanted to touch base on what I am calling the digital citizen. And there were a couple articles that I read over the past couple of weeks, and it has to do with, it starts with the World Health Organization. In June of 2023, they launched what they called the Global Digital Health Certification Network, and that's in partnership with the EU. And just a few highlights about that. There's going to be remote monitoring of individuals. There'll be smart wearables. There'll be remote data capture of those individuals. The World Economic Forum, which collaborates with the World Health Organization, calls this the fourth industrial revolution. And they want to connect nearly everyone and everything to the digital world. The United Nations feels the same. As a matter of fact, they talked about the life of a student, and quote says, walks quickly around campus through a series of automatic doors that open by detecting the digital identity chip inserted under the skin of its wrist the day he enrolled. This chip also gives him access to the restaurant and allows him to borrow a bicycle and to open the door to his small room. So you have the World Health Organization, the World Economic Forum, and the United Nations. They're kind of on the same page with this digital citizen that we may be approaching here in Kane County. In the state of Illinois, through a FOIA that I had, I had a copy of this, but the Illinois Department of Innovation and Technology awarded $53 million to Deloitte Consulting, and it is for the Public Health Digital Transformation Enablement Project, and that's to be completed by January 2025. Now, there are little details known about this project and what the deliverables are, but there are a couple of things about Deloitte Consulting that I read about, and they are that they do have a longstanding partnership with the World Economic Forum. They work directly with the World Health Organization. They're a major participant in the United Nations. They believe that the future of government rests on the future of identity. They believe in a citizen digital identity. They believe in digital credentials for reopening borders, travel, and economies. And they were involved with IBM to produce a blockchain technology to create a digital ID. One of those was called the Green Pass in UK, and then there was a vaccine pass called the Excelsior Pass in New York just during COVID. That was
Can I ask you, Mr. Young, how you think this is pertaining to us here at this
For-
committee?
yes. It starts with healthcare. So what is happening is it what they're presenting to us here is that the World Health Organization, the World Economic Forum, all those UN, they're going to start with the healthcare and putting everything digitally for our healthcare. And then next thing you know, it's going to go toward having a digital driver's license. Iowa and other states are talking about doing this right now. And then after that it comes, your bank information, credit card, and that's the future. So I just wanted to present this to the committee that this is kind of the World Health Organization, the World Economic Forum. It's what they're promoting. And I know that is something that that we've talked about, the World Health Organization and the UN having, some of their ideas implemented into the Kane County Health Department. We talked about that last month. So I just want to let people know that I wanted to bring this to the Public Health Committee because it starts with the digital healthcare information that you have, but that could be extended toward other things. And it's even being extended towards other things right now, like the driver's licenses. So it was just a FYI I wanted to bring to the committee. And if you guys are interested, if anyone is interested, I can share my my notes that I created, as well as the articles that I read to get this information.
Okay,
Thank you.
sounds like a futuristic world, doesn't it?
It's happening.
Okay. Okay, thank you. Any other new business or any comments? Okay, I'm going to cross-pollinate a little bit here and just say that yesterday, some of us had the opportunity to go on a farm tour in King County, and it was fabulous. And it sort of fed into the mental health part of what we're talking about, to be outside and to see what we were, the opportunities we have in King County and the rustic roads and the heritage farms. And I have driven by Garfield Museum multiple times. I'd never been in there. It's fabulous. So I admonish everybody for our mental health, get outside and find out what we have in King County. It was a great experience, and they're talking about doing it for the board maybe next year. So it'd be really great. Wasn't it great?
It was absolutely amazing. And the one thing, takeaway for this committee is all the chemicals and the pesticides and things that go into, we went to a flower farm, and they were even talking about, and I can't remember what country the flowers come from, because,
They had
but-
some from Peru, I remember.
yeah, and it's just the amount of like chemicals to produce them, and then formaldehyde that goes on them. So we think we're bringing these beautiful fresh flowers into our house that we got at Walmart, and really they are
Loaded.
really loaded with pesticides and things that are really bad. So, going back and, seeing the organic things and seeing even flowers and the things that we're doing to destroy our environment really kind of made me become a tree hugger. So.
It was very interesting. So just one more thing. I have this announcement here. You'll see it outside. That King County is doing a blood drive on Thursday, August 24th. And that will be downstairs here. So, okay. That will take us to our public speaking part. And Ms. Shulko, since you have to leave, would you like to go first?
Hooray for pesticides.
Okay. Very ironic that Mr. Young brought up the digital information and new business, because that's what I am throwing out there for this committee. If you would pass a resolution on medical freedom. There's a principle taught in our military officers training that says, don't listen to the words they say, but watch for what they do. And I'm talking about these 3-letter agencies such as the NIH, CDC, FDA, and the umbrella organization of the WHO. They're all connected and they all get significant funding from big pharma and foundations that have financial, not altruistic interest in the policies that they are promoting. So the websites do look great. It's all about the children, saving the world. But think about it. If their goal truly was to make you healthy and keep you healthy, they would be out of business and they would have no purpose. So follow the money. What are they trying to do? What are they doing? They're promoting managed sick care through pharmaceuticals and vaccines versus good health care. So this is where you come in as a board, where you can make a principled stand and pass a resolution making Kane County a sanctuary county for medical freedom. Because in the past couple years, we've all lived through mandates, lockdowns, censorship, harm to individuals and businesses, and it's not over. Coming down the pike from the WHO is a treaty, a global treaty that the Biden administration is really, really pushing. Some of the amendments, there are over 300. They will have a central role in directing the authority of international health. They will be a leader of global health governance. They will reallocate funding. They will distribute resources. They will handle public health. They will declare emergencies. You know, they will be in charge. And one of the ways they would do this is through like the digital ID, which I didn't know you were doing. It's pretty ironic, but most people are not educated in the Constitution and the liberties guaranteed. If a mandate comes down, they think it's law and they think they have to obey. They just don't know that they have the right to say no. And so that's why I would love for this board to pass a medical freedom resolution. Thank you. I need to go. Bye.
Thank you. That was perfectly on time. Okay, Dr. Bresnahan?
For those of you that have ears, please hear. For those of you who have eyes, please see. With all his love in my heart, I really want to carry some of the darkness out and the light in. Just like the United States Constitution, the WHO's guidelines are excellent until they are skewed or just plain ignored. WideAwakeMedia.com has shown Dr. Meryl Nass speaking at the European Parliament, which is the European Union's only directly elected institution with 705 members. Dr. Nass states, and the rest is all a quote from her, "We're undergoing a soft coup, and the idea is to create a whole new set of laws and ignore the existing human rights and other laws under the pretext of pandemic preparedness and the biosecurity agenda. The WHO is developing through all its nations, but with the WHO director and the United States in charge of pandemic treaty and amendments to the existing international health regulations that will remove the human rights protections currently embedded in the IHRs. If we enforce surveillance, censorship, get rid of freedom of speech, require governments to censor and only push a single narrative. Also, we will be subject, if they can make this work, to vaccines developed in 100 days, which the organization CEPI is planning to do. And one of the people who founded CEPI was Jeremy Farrar, who is now the chief scientist at the WHO to bring this forward. Other things that the amendments do is to bind the states so that no longer recommendations, but enforceable edicts, provide a little liability shield, get rid of intellectual property rights, move supplies from one country to another, enforce digital passports, and the Director General and WHO can demand that a pandemic or a potential pandemic exists. He can just declare it with no standards, and the countries around the world will have to obey. Also, the WHO will tell you what drugs you can and cannot use in your nation once a pandemic is declared. Obviously, the budget will increase. One Health is another part of this. One Health is a concept that was created to enable the WHO with these documents to take over jurisdiction of everything in the world by saying that climate change, animals, plants, water systems, ecosystems are all central to
Bresnahan.
health.
Thank you.
Thank you.
Come back next month.
And now we have Mr. David Dorn.
Anytime, sir.
Is Mr. Dorn present? Or online? Okay. Okay, I would like to say, I forgot to say at the beginning of the meeting that August is National Immunization Awareness Month as well, kind of appropriate for our meeting this morning. So, okay, so with that, I'd like a motion and a second for adjournment.
Tarver moves.
Carver moves, Silva seconds. All in favor?